I'm Dr. Reynolds here at Grady Veterinary Hospital. I'm here to talk with you today about preventable emergencies. The first one I'm going to talk about are the ones that we can prevent by vaccinating our animals. The two biggest ones we see here at Grady Veterinary Hospital are parvo and panleukopenia. Parvo is a virus that affects dogs, usually young puppies. It causes vomiting and diarrhea, and it can be deadly. This virus is easily prevented with a couple vaccines. It's very affordable to have your pet vaccinated, and it prevents what the animals usually need is about $1,000 worth of care, a couple days in the hospital, IV fluids, antibiotics. These things get expensive, and a $50, $60 couple exams and vaccines goes a long way in preventing this, and it almost guarantees to prevent it if they've been vaccinated multiple times. The second one is panleukopenia, which is a virus. It's also a parvovirus, but it affects cats. This really depletes these young kittens and cats. It depletes their immune system. They're more susceptible to systemic infections, bacterial infections, and it's almost always fatal, even with hospitalization and care. So it's pretty sad, and we get about 1 out of 10 of these cats out of the hospital. It's very sad, also very preventable. The standard vaccine protocol for cats and kittens covers this. It's cheap, it's affordable, and easy to do. So it's a good investment to have your cat vaccinated for that reason. The second preventable emergency I want to cover is toxicities. On a nightly basis, I get animals that have either ingested their owner's medications, eaten some chocolate, got into some rat and mouse poisoning or rodenticides, as well as there's some plants and things that cats can get into and cats and dogs can eat and that are toxic. The first toxicity I want to cover is human prescription medications. On a nightly basis, I get these animals in that ingested a bottle of medications, a couple days worth of medication. The best way to prevent your dog or cat from ingesting some of your medications is keep your medications up. Keep them on the counters, and take your medications over to the sink, so that way if anything falls, it falls into the sink, not onto the floor. The second toxicity I want to cover is chocolate ingestion. This is extremely common, especially around the holidays. We get dogs that come in that got underneath the tree, there was some wrapped chocolate, whatnot, and chocolate is extremely toxic in dogs. It can vary depending on what type of chocolate you have, but it's always best if this happens to bring your pet in to induce vomiting and get treatment. The best way to prevent this is do not put wrapped chocolate underneath a tree, and when you do have open chocolate, keep it up away from your dogs, just like how humans love the taste of chocolate, dogs do as well, so they're going to eat it. The next toxin I want to cover is rodenticides. This is a very common toxicity that we see here in the hospital. You put the rat and mouse poison out for the mice and rats to eat, and your dog gets it as well. They put things in these poisons that actually taste good, so that's why the dogs want to ingest them. There's really two different types of rodenticides. There's one that affects the ability of the animal to clot their blood. So this depletes their vitamin K. It's very treatable. We can treat these animals with just supplemental oral vitamin K, and that usually does the trick. The second type is one called bromethalin. This is a newer rodenticide that a lot of the new companies will put this in because it works very well. It kills rats and mice. Very good. And it also kills dogs. So this one we actually do not have a treatment for. We can try to prevent the absorption of it by giving activated charcoal and whatnot. But the issue is, once the clinical signs develop, there's nothing we can do about it. So if you're going to put rodenticides out for mice around your home or in a barn, anywhere where your dog and cat can get it, I recommend getting the anticoagulant version, because we can treat that. And the best recommendation is actually to use traps, because those aren't going to hurt our animals. The next toxin that I want to talk about is Easter lilies. Every year in the springtime we get multiple cases of these where the cats decide to chew on the leaves or the flowers of the Easter lily, and it's really toxic to their kidneys. What happens when they ingest these or even lick the pollens off, it's extremely toxic. The cats need to be brought into the hospital. They need to be put on IV fluids for multiple days to make sure that we're preventing the kidney damage that could ensue from the ingestion of these plants. The best way to prevent this is not get these plants and know that they are very toxic, and just not have them in your house. So these were just a few of the preventable emergencies that we see here at Grady. And as a veterinarian, my #1 goal is to keep your animals healthy.